Drugs for cough. Cough is protective reflex, its purpose being expulsion of respiratory secretion or foreign particles from air passages. Cough can be productive or non-productive. Cough may be useful or useless. Now you might be thinking that how cough can be useful. So let's see. Useful or productive cough serves to drain the airway, that is, to remove the secretions, so that airway becomes clear and it's easy to breathe. Its suppression is not desirable, may even be harmful, except if the amount of expectoration achieved is small compared to the effect. Now, drugs for cough. First, pharyngeal demulcents, lozenges, cough drops, linctuses containing syrup, glycerol, licorice, commonly used as strepsils. Pharyngeal demulcents soothe the throat and reduce afferent impulses from inflamed or irritated pharyngeal mucosa, thus providing symptomatic relief in dry cough arising from the throat. Second is expectorants, that is mucokinetics. Expectorants or mucokinetics are the drugs believed to increase bronchial secretions or reduce its viscosity, facilitating its removal by coughing. First, bronchial secretors. Sodium or potassium citrate, potassium iodide, guaifenesin, balsam of Tolu, Vasaka, ammonium chloride. Most of them are not used now. Second is mucolytics. Bromhexin, ambroxol, acetylcysteine, carbocisteine. See the contents of the cough syrup at your home and you can find these drugs. Mucolytics, bromhexin and ambroxol. They depolymerizes mucopolysaccharides directly as well as liberating lysosomes enzyme. Network of fibers in the tenacious sputum is broken, thus very useful when mucus plugs are present. Carbocisteine and acetylcysteine. They open the disulfide bonds in mucoproteins present in the sputum and makes it less viscous. Third, antitussives. They are cough center suppressants. Drugs that act in the CNS to raise the threshold of the cough center or act peripherally in respiratory tract to reduce the tussle impulses, or both of these actions, should be used only for dry non-productive cough or if the cough is unduly tiring, disturbs the sleep, or hazardous. First is opioids, codeine, ethylmorphine, folcodeine. Second is non-opioids, noscapine, dextromethorphan. Antihistamines, chlorpheniramine, diphenhydramine. Fourth is peripherally acting brinoxidine. Opioids, selective for cough centers suppression for about 6 hours. Dependence may be seen, driving may be impaired. Antihistamines, they are added to antitussive or expectorants formulations. Afford relief in cough due to their sedative and anticholinergic actions. Chlorpheniramine maleate, diphenhydramine. Bronchodilators. Bronchodilator relieve cough in such individuals and improve the effectiveness of cough in clearing secretions by increasing the viscosity of airflow during the act of coughing. It is used only when the element of bronchoconstriction is present. Thank you.